tract infection is defined as any infectious disease of the upper or lower respiratory tract. The components of the upper tract include the nose, sinus, mouth, pharynx, and larynx. And the components of the lower include trachea, bronchi, bronchioles, alveoli. Some of the infections of the upper tract include the common cold, laryngitis, pharyngitis, acute rhinitis, acute rhinosinusitis, and acute otitis media. Some of the infections of the lower tract include the acute bronchitis, bronchiolitis, pneumonia, and tracheitis. The causes include viruses and bacteria, in which you have rhinovirus, which is responsible for your common cold, and you have the bacteria, chlamydia pneumonia and streptococcus pneumonia, which is responsible for pneumonia. Some of the symptoms that you might develop include fever, fatigue, headache, pain during swallowing, wheezing, muscle aches and pain, nasal congestion, septum production, and the most prominent is the cough. They can also lead to complications, which include respiratory arrest, respiratory failure, congestive heart failure, pleurisy, pleuritic pain, and pleural effusion. Some of the treatment include medications for pain and fever, cough, rest if it's just the common cold, and drinking plenty of water to stay hydrated, and antibiotics for pneumonia. To prevent respiratory tract infections, you would use clean water for washing yourself and drinking, vaccinations for flu and pneumonia, ensuring food is not contaminated. As it relates to refugee camps, the main morbidities in the refugee camps include the respiratory infections, diarrheal diseases, and skin diseases, all related to poor living conditions as well as non-communicable diseases. Data collected from a camp in mainland Greece showed that 38% of infected patients were due to respiratory infections. The World Health Organization fact sheet of the Rohingya refugees in Cox's Bazar in Bangladesh also showed acute respiratory infection as the main morbidity, along with suspected varicella and acute watery diarrhea. More so, overcrowding and congestion, as seen in all camps, that leads to rapid spread of these infections. It was estimated that there was close to 1 million Rohingya refugees in Cox's Bazar camps in Bangladesh and close to 3,800 Syrians in the mainland camps. Also, there are insufficient safe drinking water and sanitation services, which allow the spread of these bacteria and viruses. There's also environmental factors such as floods, landslides, fires, among others, that limit the resources and cause contamination of the already resources that they have. And the most prone to these infections include the children and elderly, which have decreased immune response. As the data shown from the camp in Greece, that 66% of the children had respiratory infections. Some of the strategies applied include the Medicines Sans Frontières, which is a humanitarian organization that operates 4 hospital-level inpatient facilities in the Cox's Bazar district in Bangladesh and 1 inpatient outbreak response center. They also have health posts that offer different services, including outpatient consultation, vaccinations, follow-up of non-communicable diseases, sexual and reproductive services, and mental health services. They also build water distribution systems to prevent the water from being contaminated. Another organization called the United Nations Aid Agencies and NGO partnered and launched the 2019 Joint Response Plan for the Rohingya humanitarian crisis. They built deep wells, waste treatment plants, as seen in the picture, to discard the fecal matter. And they also assisted in solutions for environmental problems such as landslides. Their strategies are in place but not as effective. So the proposed solutions would be to have agencies in place to monitor the health hazards and be able to act on it quickly and treat it effectively. There's also a problem with overcrowding and congestion. So a solution would be to make new camps or integrate the refugees within the citizen population. Also, have frequent health checkups that are mobile and conducted at the camps to provide medications, vaccinations, and most importantly, health education. So the refugees can be aware of what causes these infections and how to stay away from it. You can also have new countries to open their doors by having more negotiations among them. And lastly, you can try to build proper infrastructure with the basic necessities that won't be damaged during the environmental changes. Thank you very much for listening.